Hello everybody, and welcome back to my YouTube channel. I'm your boy Dr. K, as you all know, and today we're going to be talking about one very interesting topic: autism. Autism spectrum disorder. It's a topic that is so dear to my heart because I've had a lot of people ask me this question, and I really went into some deep study to be able to bring out some important facts and also debunk some views and also support some, because there's some interesting truth in everything that people have been saying about autism. I mean, I've had different thoughts, I've had different opinions, I've had different people come to me and say, oh, Dr. K this, Dr. K that, and it's important we talk about it now. I did a lot of research, and I hope we can get into it, So, what is autism? What is autism? The first thing to know is that autism is a neurological problem. Autism is not like malaria. Autism is not like an infection. Autism is a neurological problem, something in the brain that usually will continue all through the life of that patient. Autism spectrum disorder. If you take a spectrum, a spectrum is like light spectrum now, from one end to another end, light spectrum. It means that at every point in time, there is something different on that line. I mean, in that spectrum, there's something different at every point in time. That is what autism is. It means people who have autism or fall into the spectrum experience different things at different times of their life. In some people with autism, they might need support throughout their life. They might need help with even the basic things. But then, some people with autism, they might not need so much help. Some people are actually very independent. So you can see, when you talk of spectrum, you're talking of something from one end to another, where one end is very, very severe and very, very bad, while the other end is not so bad, and the person can still cope with normal day-to-day life. Most autistic patients have problems with communication. Some of them have sensory sensitivity, or some of them have repetitive behaviors. I'm sure many people can relate with that, While on the other spectrum, that's like the spectrum of people the ones that have it quite bad. While on the other spectrum, you see some autistic patients some autistic children or patients, who are very good at music, very good at arts, very good at mathematics. You see some great guys, in the world of art and music, even mathematics, that are said to be autistic. And that goes that thought that says that it is not so bad for some people. And what you experience in your own child with autism is usually different from what another person experiences. There may be some similarities, but usually, it's quite different, because many patients will not fall in the same spectrum. They'll fall into different aspects of the spectrum. I say, so we try to look at autism today and look at the 2024, what 2024 is saying about autism, and we do take it from the angle of patient's view and also clinical view, and also try to put out some education, about autism, so that we can have a good understanding when we talk about it. As I said earlier, it's like a spectrum, one end to the other. One end is very severe, the person needs help almost throughout his or her life, while the other end, the person might not need so much help. The person might be able to stand on his or her own. I mean, I've seen quite a number of autistic patients who have been able to go on boat cruise themselves, people have been able to go to libraries themselves, people have been able to go to work themselves, people have been able to do so many things. But then there's this high level of excelling they have when they try to embark on other social things. They are we're quite intelligent, but on the other hand, as we discussed before. And I need to reiterate, it's not something that can be treated. It's not malaria. It's not an infection that you take medications for. And these patients usually need support at some point in their lifelong. But I'll be putting out some interesting facts. He said that there are some attributes to show that the awareness of ASD has improved. That people have been more informed about ASD now, and you can see that there's more information about it now. I mean, almost every corner, people are talking about ASD. I mean, in my DM, I got a couple of patients who have complained to me about their child being diagnosed with autism. And one of the things that have caused the increase in autism diagnosis is because there is now a lot of diagnostic tool. People have been able to diagnose it. Experts have been able to diagnose it more than what it was before. If you agree with me, I was speaking with somebody and I was able to ask her some questions. And do you know that when we were children, we had this classmate who was funny, who wasn't exactly like how all of us were. He wasn't talking properly, he wasn't doing things coherently. And growing up now, looking back, I know it wasn't Down syndrome. I knew it would have been autism. So autism the diagnosis has been lifelong, but the illness or the condition, so the condition has been lifelong, but the diagnosis is just what people are now getting used to, because now we have more children being diagnosed, because we have expert opinions now coming into it, and more children are being diagnosed. Note, if they say this child is autistic, it doesn't mean the child is on the bad spectrum of autism, because when you hear autism, your alarm bells go to the worst of the worst. I've seen children who are autistic even in the past few days, and they are not so bad. I mean, they're not so bad. And it's also important to know that people who come from low-income areas, so ethnic groups who do not have a clear predisposition to hospital, they get lesser diagnosis. As we know, where I come from, back home, the diagnosis of autism is not so marked, because for real, many people still live in the rural areas where that is really not the diagnosis they are looking for. That's really not the problem there. When people still grapple with poverty, with food insecurity. So making the diagnosis of autism back home is not the thing. But by the time we move out of our comfort zone, move into the developed world, you see that the diagnosis keeps increasing, because now they are able to now experts are able to see the children more and make the diagnosis. The reason why you think these people are the problem, I'm going to tell you now as we go forward. It's important to know that the rate of autism is rising, but causes are not well understood. There's no, but one, the cause of the autism, we'll delve into it. There's this shady area that when I did some research, and I found out that there's some sense in this research when it comes to autism, and some interesting things that I'm going to share with you now. So they said one of the causes is that there's a rare gene changes and mutation, as well as small common genetic variation in people with autism. It means that autism has a genetic component. It means that autism has a genetic component. It means autism is passed down from the genes, either through some changes, some mutations. So it means there is a possibility that the parent has some element of autism, but then by the time it's passed down to the child, there's a mutation that takes place that makes this child now become full-blown autistic, also in the spectrum. So that's one. Genetics is the reason why a child will be autistic. It means it's passing down from the generation, and then there's some changes that keep happening to that gene that makes it manifest in the child. So what is that change? What is that thing that makes that change come? Interesting to know that high level of stress during pregnancy can also be connected to autism in children. So, as a mother, pregnant woman, especially between the weeks of 25 to 28 weeks, think back when you were pregnant. When the child was 25, it was between 25 and 28 weeks. What really happened? How did the pregnancy go? Was there physical stress? Was there mental stress? Was there emotional stress? These stress are what has been linked to cause a change in the genetics, in the gene of the child that could have made the child become autistic. I mean, I went deep diving into it, and I got some information. I got this information in particular to show that stress levels in pregnancy is directly or can be directly linked to autism, especially when the stress level is between 25 to 28 weeks. And looking at where we are coming from, I don't think there's hardly any pregnant woman that who doesn't experience some type of stress or the other. So now look at it like the fact that, okay, the pregnancy is stressing you, especially 25, or maybe there's a problem in the pregnancy and the person is stressed between 25 to 28 weeks. And if you look at it, that the mother already has some genes that will make the child become, that could make the child become autistic. So the genes now being modified by the stress now makes the child become autistic. I mean, so that's how that's the flow, in pregnancy, coming from the genetic aspect. Also, I had a conversation with one particular lady, a mother of an autistic child, who really was worried, and I said, okay, look at it this way. Your father and your mother had how many children? Let's assume she said he had 4 children. Okay, daddy, mommy, 4 children. That's on our own side. Then on the husband side, daddy, mommy, 5 children. So daddy, mommy, 4 parents have produced 9 children. So if there's any element of autism in one of the parents, maybe the mother or the mother of the woman or the mother of the man, if there's any element of autism there, looking at the stress they pass through, in the pregnancy, especially 25, 28 weeks, now having children who have a higher risk factor to become autistic, but then maybe it didn't manifest. Then in those children, now them getting pregnant with that little autistic traits that they have, those little autistic traits, now getting pregnant, exposed to stress between the age of 25 to 28 weeks of pregnancy, now having children, it increases the likelihood of being autistic. So, and that's how it goes. That's how it goes, That's how it goes. Also, another interesting fact is that women who get pregnant before the age of 35, they have a higher likelihood of having children with autism. Women who get pregnant before the age of 20, in fact, women who get pregnant under the age of 25 are more likely to have a child with autism than older women. It's a fact. It's a fact. So if you had your children at a higher age of 35 and above, maybe autism is not what you'll be worried about from scientific research. Maybe autism is not what you'll be worried about. Maybe some other things you could worry about, some other things, but maybe not autism. Autism occurs in women who have their children below the age of 25 and before the age of 35. So another thing I like to debunk, because I got a lot of messages, about getting the MMR vaccine, and then maybe after the child got the MMR vaccine, then the child became autistic the child regressed in his milestone. So, from research, it shows that there is no direct link between vaccination and autism. There is no direct link. But one thing I was able to pick out was that the behavioral change of that child is usually post-injection, post-vaccine, or post any traumatic event. The child senses it as a traumatic event and reacts differently from what he or she used to be before. Also, another important fact is that autism is more pronounced in male children than female children. In fact, we have the disparities about 70 to 30%, 70% male, 30% female are diagnosed with autism. So there's no direct link between autism and vaccine, especially the MMR vaccine. Although some people say, oh, they refuse to take it and then they think their child is fine. They didn't take the booster MMR dose when they got to their place of travels. Some people say, oh, they took it and then that's when the child started regressing. Some people say they took it, the child had the fever for a few days and then the child is fine, you know. But I've seen children who are diagnosed with autism right from back home, and getting here, they just get on the spectrum and they just start getting help, and then they are getting better. You know, they're getting better. So I want us to erase this mind of this conspiracy mind that, oh, there's a conspiracy theory, there's something against some part of some kind of people, from some kind of people trying to mitigate this, mitigate that. No, that's not the case. You know, there is a high level of diagnosis now because there are more experts looking at it. One, two, there are more children. We have more children now than before. You know, also because our pregnant women get stressed a lot within their 25, especially within their 25 to 28 weeks. It's not a conspiracy theory. It's not a problem. It's not a problem with the vaccine. Also, so what can we do now to help people who are autistic? You know, we see a lot of, now we see that it's a problem that we have. It's a problem that's come to stay. So how do we help? First thing is to educate yourself. Read about the characteristics. Read about the way your child is manifesting. You know, read about how you can help that child. You know, it's important to be very patient with autistic children. You know, they need some level of care and some gentleness. It's important to state at this point that mothers of autistic children are the most stressed people. You know, if you look at the level of stress that females go through, mothers of autistic children are the most stressed because it is not easy. Sometimes you have to run after your kids when they throw the tantrum. Sometimes you have to restrain the kid. You see some autistic children who are even stronger than their mothers already. You know, so you have to experience a lot of patience, and then you have to try and create a clear communication path. You know, sometimes when the child needs therapy, when the therapy comes in, they do a great job to help the child streamline the child's mind into concentration and communication. Because it's important to use clear languages to talk to them, not slangs, because they might not really understand it. And also be mindful of non-verbal clues. You know, there are some things the child will do. You know, there's a way you look at the child and you won't talk. There's some gestures you make at the child that makes the child feel very bad or can worsen their tantrum, or also make them feel welcome. It's important that autistic children should be celebrated. It's not easy. They're not finding it easy themselves, but when they achieve something, try to celebrate them. When you say that, oh, this my son has been able to achieve saying these words, celebrate him or her. You say, oh, this my child has been able to, you know, complete a certain task. It's important to celebrate them because it's not easy for them. They're trying their best to be as good as they can be because at the the brain is not really allowing them to do it as smoothly as we all expect it to be. So it's important for us to learn all that. I got a few DMs. Okay, I think I mentioned it before about people talking about what they think about the vaccine, and I've been able to debunk that autism has no direct link to the vaccine. You know, what I saw was the way the children react to that traumatic event because they have the autistic trait. It could set them back. Thank you very much. I think with this, I'm sure you've had enough information about autism, and please, I would like you to share with people, like the video, share with people as much as possible, because it's an information that is very useful in this time that we are, in this climate that we are. It's important people learn a lot about autism, stop the stigmatization, and stop spreading the conspiracy theory, and try to see how things get better for us going forward. So I mean, knowing these facts of pregnancy, knowing these facts from genetics, I think it will further reshape our mind. Knowing these facts about age will further reshape our mind into how we can deal with autism over time. Thank you very much. I'll see you again in my next video. Bye for now.